Hi, my name is Carrie Med. This is for SIMS440 Continuum of Care, Comp 3, and I appreciate you taking the time to watch my video. The Continuum of Care is a patient-oriented system of care that spans an entire lifetime. It guides and tracks the patients over time through a comprehensive array of physical health, mental health, and social services across all levels of intensity of care, per American Sentinel University. As a NICU nurse, our infant patients use the continuum of care in regard to case management on a daily basis. All of our patients are seen by a team at the same time that includes the neonatologist, a pharmacy technician, the dietitian, their nurse for the day, their charge nurse for the day, a respiratory therapist, a speech therapist, and of course, a social worker. This team of professionals identify the needs of the infant and the goals that will be set for their current plan of care, any changes that need to be made for them to go home. Ensuring that they have the proper care to go home and/or the additional treatment at another facility that they might not possibly need, it's critical to the success of each infant and their quality of care. Additionally, social services that may be needed are identified and discussed at that time that may include child protective services, financial assistance in regards to transportation, gas, or lodging for the family in order to be able to have them close to the baby or see the baby on a regular basis during their NICU stay, assistance in obtaining a car seat for a family that maybe they can't afford it, maybe they don't have access to be able to get one, and other social needs that will affect the continued care of the infant moving forward. The NICU department is focused on several different quality initiatives to improve the overall care of our infants. An example would be the Kangaroo Care Committee that consists of 7 nurses and their educator from the NICU department. Their goal is to increase the kangaroo care participation of families that initially encourages bonding, physically helps the infant with temperature regulation, increasing their calorie absorption, and stabilization of vital signs. It also begins the physical and emotional bond that leans into future health goals such as non-nutritive sucking, and eventually breastfeeding. Currently, due to the increased awareness of the benefits of kangaroo care to our families, the participation ratio has also increased from less than 20% to over 40% just in the last 6 months alone. These are for our level 1 babies, so that is awesome. When using an example of kangaroo care program in the NICU, an impact to the bottom line of the organization is a realistic goal. It may seem initially the only benefits are to the baby and the family for bonding or quality care. However, that's just the beginning. The more stable an infant is, the higher the possibility that the infant will continue to have progress growing with minimal complications or other health issues. The shorter time period an infant stays in NICU, the fewer financial resources that are used, therefore costing the facility less money. Resources include personnel, medication, treatments, and even physical supplies. And when you have a baby that's in there for maybe 100 days, that bill adds up. The quality indicator of continuity can positively influence the quality of care for mothers and newborn babies. By providing continuity and reviewing the overall needs of the mother and the newborn babies, risk factors can be identified and mitigated to improve health outcomes and improve quality of care. Healthy Newborn Network identified several of these areas. They included counseling to mothers and health education on recognition of danger signs and appropriate care seeking. What does that mean? That means education on recognizing when something's going wrong with my baby and who I need to get and what I need to do about that. Do I need to go to the emergency room? Do I need to call my primary care provider? Do I need to call my pediatrician? What do I need to do because I'm on my own? Counseling and health education on routine care practices such as exclusive breastfeeding and good thermal care practices. Dispensing and related counseling for routine preventative interventions. Example of that would be good core care and iron supplementation for infants. And then assessment, case management, and referral on any identified complications or risk conditions. So that means we identify an issue for a baby and then we use case management in order to help track that baby and put that baby where they need to go. For an example, if you have an infant that's not PO feeding, which is not eating by mouth by a bottle, they have to learn how to do that. If they don't learn how to do that, they can't go home. However, they may be eligible for a G-tube placement. So then the baby's still getting the nutrition they need as they continue to progress and work with PO feeding, eventually maybe even table food. That's just an example. By encompassing all of the areas, a wide net can be cast to cover many areas to ensure that the care is provided on multiple fronts and that the quality of care improves. Performance can directly impact hospital reimbursement. Absolutely. Performance in a NICU includes safety, continued education, compliance, documentation, and training, all of which are required for a NICU's designation. For example, successfully obtaining designation for a Level 3 NICU requires the hospital to be compliant with the federal legislature in order to be eligible for Medicaid reimbursement. That's according to the Texas Department of State Health Services. You can find additional information on all the requirements regarding that legislature on their website, and they have it in place so that hospitals are required to comply on multiple different fronts. Since approximately half of our patients in the NICU are covered by Medicaid, it's critical that a facility maintain their designation to keep the reimbursements in order to fund the department and pay for many of their services. Hopefully this answers your questions or gives you a good idea about NICU and the continuum of care, and I appreciate your time. Thank you.